Today I'd like to talk about postpartum depression and anxiety. Postpartum depression and anxiety affects 15 to 20% of all new mothers. And the thing that most women do not realize is that postpartum depression doesn't necessarily begin the moment you've given birth. It can appear very gradually or very suddenly anytime up to a year after a woman has given birth. Postpartum depression is something that is becoming more discussed, and it's becoming an issue that is not quite so in the dark, which is a very good thing. There are a lot of misconceptions about postpartum depression, and so I'd like to take the time to discuss a few of those and talk about postpartum depression and anxiety. Most people, when they think of postpartum depression, think of sort of an overwhelming depression, maybe an inability to get out of bed, an inability to care for the child, things of that nature, which can certainly be the case. But it can also be a variety of other things, and one of the things that is most commonly experienced is a feeling of anxiety. Now, anxiety can be something that is difficult to pinpoint because a woman may or may not have experienced anxiety before she had the child. But typically it is perpetuated after she has the child, and she and her husband and or family members can notice a dramatic change in her anxiety levels and depression. Some of the commonly experienced symptoms of postpartum depression and anxiety are a lack of appetite or a change in appetite, an inability to sleep. I've seen many women that come in and their only symptom they think is that they are just unable to sleep even if the baby is sleeping. And this can be a very, very big red flag that there is postpartum depression or anxiety. If a woman is unable to sleep when her child is sleeping. This is not necessarily for sure an indication of postpartum depression or anxiety, but it can lead to anxiety and depression. In fact, they actually have done studies that if men are in a situation where they are not able to sleep for a long period of time, over a long period of time, that men actually develop symptoms of postpartum depression as well. So for all the women out there, you can rest assured that it is not necessarily just a sign of something that is wrong with you at all. It is something that we all experience if we're not getting enough sleep or rest. In addition to that, there can be hormonal changes that a woman deals with after having a baby that can definitely be the cause of postpartum depression. And in addition to that, thyroid issues can also be a cause of these types of issues. Continuing on with the symptoms, other symptoms may include, but of course are not limited to, feeling completely overwhelmed with just daily life tasks, or feeling irritable with every little thing, feeling irritable with your spouse, with your children, or with anything in general, can also be a warning sign of postpartum depression. Loss of interest or pleasure in things that or activities that a woman normally felt were a big part of her life and she normally enjoyed can also be a symptom. Oversleeping and, as I said before, insomnia are symptoms. Oversleeping can be a little bit tricky to spot because, of course, if a woman is up with the baby a lot at night, she also may be tired and needing more rest. Generally, I find that a woman knows if she is not getting enough sleep or if she's sleeping too much. She usually has a sense of how much or how little sleep she needs. Difficulty concentrating, making decisions, or remembering. These are other symptoms, and again, these can be common of new mothers in general, but if they go beyond what a woman feels like is reasonable, they can be symptoms. Restlessness, irritability, or excessive crying, chronic aches or pains, or physical problems that just don't seem to respond to treatment. if these things are more severe, things like feeling suicidal, feeling like a woman doesn't have an interest in her child or in her newborn that she thought she would, those can all be red flags that something is going on. Particularly if she just feels completely indifferent toward her baby, and if she just doesn't, motherhood is not what she thought it would be. She feels very flat. She doesn't want to interact much with her child, things of that nature. She also may have, even taking that a step farther, she may also feel like she wants to harm the baby, or that the baby is sort of an invasion of her former life and she just wants to get rid of it. Of course, that is something that immediately needs to be addressed and dealt with, because that can be a situation that has some devastating consequences. So that, of course, is something that needs to be tended to right away. Now, many women are afraid to speak up about these symptoms because they fear that these symptoms are not normal. They're embarrassed or ashamed or feel guilty about these symptoms. They may actually love, in fact, women do love their child very much, but they just don't understand their feelings that they're experiencing toward their child. So it's important, and I want to reiterate how imperative it is that a woman seek help, and it is not an indication of how much she does not love her child or does love her child. It is just a chemical reaction to whatever is going on in her body. So I want to encourage women, if you are experiencing any symptoms like these, to get the help that you need. And I want to also encourage you, many women are afraid that their children will be taken away if they do get help. And of course, every situation is different, but the symptoms that I have described are very commonly experienced symptoms, and I don't want you to feel alone in that if you are facing them. So if you are, the best course of treatment is individual therapy, medication, and group therapy. Those three things are indicated in this type of situation, and all three are needed. Any one of those things is helpful but does not completely take care of the issue. So it is important that a woman receive all three types of support to deal with this type of thing, and the outcome is rather positive. So feel encouraged that help is out there, and you can get treatment if you're experiencing postpartum depression or anxiety. Thank you.